Hello and welcome. I am Prachi Gupta. As the whole world battles the coronavirus pandemic, every single day is bringing in hope. Hope of a breakthrough. Hope of a new vaccine. In this COVID-19 bulletin, we bring you facets of that hope. Curated information on the new developments in science and technology each day that can help us in managing and overcoming the ongoing crisis. To help the country in this time of crisis, various CSIR laboratories have taken up the responsibility of carrying out COVID-19 diagnostic tests. Now, Dehradun-based CSIR's Indian Institute of Petroleum or CSIR IIP will also join this league soon. The institute has established a state-of-the-art testing facility and will be conducting RT-PCR-based tests for diagnosing COVID-19 infection. For testing, the institute will be following guidelines and protocols set by the ICMR. CSR IIP is in constant touch with Uttarakhand State Health Ministry and all government hospitals to make the facility fully operational and initiate testing by mid-May. Currently, the samples from the Dehradun district are being tested at AIIMS Rishikesh and Doon Hospital. This new facility at CSIR IIP will now share the load of COVID-19 testing of the region. Apart from the regular testing, the institute will also be adopting a faster micro-RT-PCR based analysis method for sample screening. For this new testing regime, the institute will be technically supervised by CSIR IGIB. The new testing facility will be run by a team of IIP scientists led by Dr. T. Bhaskar, which will include Dr. Devashish Ghosh, Dr. Sunil K. Suman, Dr. Deepti Agarwal, and Dr. Dipatarika Das Gupta and other trained technicians. Let's hear more about this new testing facility from Dr. Anjan Ray, Director, CSIR, Indian Institute of Petroleum.
So we have a very nice biology facility which had an RT-PCR machine. When we saw that COVID-19 testing was becoming an issue, because in order to manage an epidemic, you must test widely, and Uttarakhand did not have too many testing options, we decided to repurpose our biology facility to do COVID-19 testing. We're not a medical lab, we're not a pathology lab, but because we wanted to support the state government and the country in this epidemic, we made this effort and investment. We also made a design effort because a typical COVID-19 lab will be inside a hospital or inside an existing path lab. And as we know, this virus has a risk of transmission. So we wanted to build a concept where the COVID-19 building would be a standalone building. We've used what we call a porta cabin, a portable facility, and we've assembled it into a full-fledged COVID-19 testing lab in a period of roughly 29 days, let's say 5 weeks, including other bits and pieces. And this is a model you can replicate for testing of this virus or for testing of any other pathology in a remote area. It's very easy to put together, and it didn't need a lot of engineering. We got extremely good support from our vendors and our own engineering team. And essentially, it is like building a lab from scratch in about 5 weeks, as long as you have the equipment.
Scientists are coming up with the innovative approaches to combat the newly emerged enemy. One such approach is being tried by scientists at the Indian Institute of Technology or IIT Delhi, where they are trying to develop the peptide-based therapy to treat COVID-19 infection. A peptide is a small protein made up of 2 to 50 amino acids. The scientists at IIT Delhi are utilizing bioinformatics tools to design a novel peptide for blocking coronavirus. This research is being carried out at the Department of Biotechnology's Center for Excellence for Biopharmaceutical Technology at IIT Delhi. As the number of coronavirus cases rises in the country, so does the associated infectious medical waste. This medical waste, if disposed of without disinfection, can lead to further spread of viral infection in the country. Now, the scientists from Thiruvananthapuram-based CSIR's National Institute for Interdisciplinary Science and Technology have developed a flocculation-based disinfection system. This new disinfection system is especially useful for safe disposal of medical waste containing pathogens such as coronavirus in current times. The institute has also signed a non-disclosure agreement with Kerala-based CML Biotech Private Limited to bring this disinfection system to the market. That is all for today. We will be back with another edition of COVID-19 Bulletin soon. I hope that you all are safe and maintaining social distance. See you soon. Namaskar.